Let's talk more about this with Dr. Jay Wolfson. He's a professor of public health, medicine, and pharmacy at the University of South Florida. So here we are, the traditional goodbye to summer weekend. Florida is a popular vacation destination, but has also been a COVID hotspot in this country. What are you seeing there?
We're seeing people continuing to travel, making plans because they've looked so forward to being able to get away. It's been a rough year and a half. You know, a year ago today, we didn't have the vaccine. We didn't have the monoclonal antibodies that were available when people got sick. People were still assuming that they could go out and enjoy things with their families, and it spread the disease. And we didn't have the Delta variety, which, as we all know, is 1,000 times more virulent, more powerful, and 1,000 times more infectious, easier to get. So we're seeing a lot of people saying, you know, I'm willing to take the risk, and I'll be as careful as I think I can. But, you know, so many people don't know somebody who's died or don't know somebody who's gotten sick. And even if they do, our country is divided right down the middle in terms of people who say, I don't trust the government, I don't trust the vaccine, I don't trust the pharmaceutical companies, or I don't believe in vaccines, or I think I have to do this because if I don't, I'm going to get sick. I have an obligation to protect myself and my families. We've made progress in getting more people vaccinated, but we still have large segments of the population that are not vaccinated. And in addition to people getting sick and going to the hospital, by the way, hospitalizations have leveled off a bit. Deaths have remained lower than they were last year. And unless the death rate really climbs, and unless children begin to die at a higher level, we don't expect to see a change in public policy here.
What do you think we'll see, Dr. Wolfson, after this holiday weekend? Kids are going back to school, more kids after this weekend. And here we are, college football Saturday in America. Stadiums are packed with tens of thousands of students right now.
They are. You know, it takes about 2 to 6 weeks before we see the effects of the expression of the disease in populations. Because especially young, healthy people are going to give it to other young, healthy people. It's going to be asymptomatic. And as we know, even if you've been vaccinated, there's a chance that you can have a breakthrough infection. And we're seeing a lot of those coming up now. So we look to 2 to 6 weeks down the way to see whether or not we're going to see a new spike and whether or not we're going to see more people who have been vaccinated getting sick again. But we absolutely have to worry about now is what we're calling post-infection chronic syndrome. People who have been infected maybe even get mild symptoms, but a year or longer down the way, the virus, the way it reacts, it embeds in your tissue, and it could explode and give people heart disease, kidney disease, lung disease, and brain diseases for the rest of their lives they've never had. That's the next segment of our lives with COVID going forward.
We have about 30 seconds left, so I quickly need to ask you, you mentioned this leveling off of numbers. Do you think we've seen the peak of the Delta variant, something that has happened in other countries?
All of the models that we've been running and all of my colleagues who've been doing that indicate that the peak looks like it may have happened about right now. But a peak is not a stop. A peak is just a high point. It could be leveling off, and we could have these levels for a while. That's why we have to watch for the next 2 to 6 weeks to see if it goes up or down or stays the same. And that will be affected by all the activity during this Labor Day weekend when people get together to have their last hurrah for the summer.
All right, Dr. Jay Wolfson, we appreciate your time. Thank you so much for joining us from Florida.
Be safe and be well. My pleasure.